Thank you, John. Thank you all. It's such a pleasure to be here with you today and to be among colleagues with whom I've worked with in parts many years ago. So let me perhaps first start with a round of applause to all patients, all community voices that are here in the room and that, as you said, Teresa, are the fuel for us in the response to hepatitis in our elimination efforts for hepatitis. So big round of applause. And then let me say that I feel that well-coordinated and evidence-based advocacy is more important than ever. And let me briefly say why I feel so, and perhaps start on a personal note. You know, actually before joining WHO more than 5 years ago now, I spent a lot of time working with John and others on hepatitis. At the time, working largely on simplifying diagnostics, simplifying diagnostic pathways, making treatments more affordable and BAAs more accessible. So I feel today the situation is very different. Now the tools are by and large there. The diagnostics are simpler. The treatment is highly effective and accessible. And yet, listening to the discussions we've had all day, my main reflection is this, that the core challenge has shifted far less than I would have hoped it would have 7 years ago. And that is that we're still struggling today to translate what we know into delivery at scale in the vast majority of countries. And this is now no longer primarily a technical challenge, but it's a question of policy change, it's a question of system design, and perhaps most importantly, a question of finding sustainable financing approaches and solutions. So that's why I think advocacy matters more than ever, because to challenge these hurdles, we need more than anything political will. And what is better placed than you, our advocacy platforms, to galvanize that political will and help us drive change. You know, let me speak very briefly about the Sierra region, our Southeast Asia region for WHO. We've made a lot of good progress, and I would even say we're able to provide some blueprints there. The Maldives have achieved triple elimination in 2025, a world's first. Thailand and Sri Lanka have both advanced dual elimination and are building on that progress for triple elimination. India, as you may know, is scaling nationwide approaches to elimination of vertical transmission and has expanded Hep C vaccination and screening quite a bit over the last 2 years. So these are areas where political commitment has made a real difference. Yet beyond this, I would say progress is highly uneven and quite fragile. We see oftentimes that hepatitis programs are only partially integrated into health systems or UHC packages, and further scale up of diagnostics and treatments very much depends on, again, very fragile financial resources that may or may not come. So, I would say that one lesson we as Sierra took from this is we clearly know what works, and we know where progress stalls. And that's where we now need every patient, every voice we can bring together, every community to catalyze further change, to make sure that hepatitis is embedded in health systems and that they're financing and in the financing frameworks. So, for me, the real question moving forward is how do we make hepatitis visible where decisions are actually made in national budgets, in UHC reforms, but also in much broader discussions on equity, maternal and child health, and non-communicable disease discussions. Because I think we would all agree that hepatitis is not only a health issue, it's an equity issue, it's a social justice issue, and it's a financial protection challenge that we face. And ultimately, it's about productivity of countries and return of investment for any given country. So please help us to galvanize political will. We as WHO and WHO Zero stand firmly committed to you as our advocacy platforms, to you as our partners, and to all patients that help us raise the voice and make the important case for why hepatitis elimination should be a priority everywhere and for everyone. I thank you.